Hello, I'm Dr. Michael Jonesco, an Ohio State sports medicine physician, and in this brief video, I like to discuss stress fractures. Running season is upon us, and stress fractures are a leading reason that athletes miss training or race time. Stress fractures are injuries to the bone, and bone comprises the skeleton, which is responsible for providing our body with mechanical support as well as locomotion. Bones can undergo different types of injuries. And when people hear of broken bones, they often think of macro trauma, or one acute traumatic blow in which one force is too great and causes an acute fracture, much like the snapping of a twig. Stress fractures, on the other hand, are a result of micro trauma, or small repetitive injuries that occur at the cellular level, usually without any specific event. In the body's natural state, bone is constantly going through a process of remodeling, in which there is a balance of bone being broken down and replaced with new, healthy bone. Anytime you increase the load or force on bone, it breaks down faster, causing a negative bone balance. But if the athlete is healthy and bone is given adequate recovery time, our bodies can respond appropriately by rebuilding bone to quickly compensate, restoring balance. A stress fracture occurs when the body has inadequate remodeling response, allowing for more bone to be broken down than is replaced. Basically, you're breaking bone down faster than you can build it back up. So how do stress fractures present themselves? It's important to note that stress fractures can occur in any bone undergoing excessive stress. Typically, they are seen in lower extremities in running or jumping athletes. Most commonly, I see them in the tibia, or the shins, or the metatarsals, which are bones of the feet. However, as I mentioned, any bone can be affected, including the upper extremities of throwing athletes or ribs of rowers, where large muscle groups pull repeatedly on their bony anchors. Patients with a stress reaction or fracture also report a gradual but increasingly achy or bruising pain over the bone affected. The pain increases with activity and is initially relieved with rest. However, if one continues to train on the injury, pain starts earlier and earlier in the workout, with longer periods of recovery time needed for the pain to subside. The injury can become tender, even to light touch, and eventually becomes a constant ache, including nighttime pain. Continuing to run through the pain is not recommended, as it can lead to longer recovery time, full-on fracture, chronic pain, or even the need for surgical intervention. We are aware of several risk factors for stress fractures. These include being highly active, and as mentioned, stress fractures are seen frequently in distance runners and dancers. Anyone, however, who has a significant change in their training regimen, for example in distance, intensity, or frequency, is at risk. Previous injury, anatomical differences, or simply being young or female are risk factors, especially those with a history of eating disorders or abnormal periods. Diagnosis is best done with a detailed history and physical exam. Sometimes x-rays will show changes that are helpful, but most stress fractures are not visible with simple x-ray, especially within the first 3 weeks. Oftentimes, more advanced imaging, including MRI or bone scans, are needed for definitive diagnosis. Typically, I like to go beyond simple diagnosis, or what your injury is, and find out why your injury occurred. Evaluation of shoe wear, training history, diet and supplementation, medication, menstruation history are all part of the bigger picture. Oftentimes I will use a gait analysis in which our experienced staff watches and videos your running form to pinpoint any abnormalities in your running that puts extra stress or load on the injured area which would predispose you to injury. How do you treat stress fractures? As we have discussed, stress fractures are really overuse injuries. Logically then, the best treatment is to underuse the affected limb, which means taking some time off and allowing the bone to heal itself. If it's a lower extremity injury, that means no impact activities like running or jumping. Sometimes crutches, bracing, or casting is helpful. Rarely, but occasionally, surgery is recommended for certain high-risk stress fractures. After a period of rest and activity modification, the pain will improve and we will start into the recovery phase. I typically begin with a gradual progression of increasing intensity of exercise, including swimming, biking, elliptical, and then returning to running or sport. Additionally, we are working on correcting the risk factors. We do this by looking at possible training errors through a strengthening and stretching program. A shoe change or orthotics might be warranted, and a change in diet or supplementation may also be necessary. As with any health issue, prevention is always the best plan. For stress fractures, remember these 3 tenets. The 10% rule. Do not increase intensity, frequency, or duration of your workout or training by more than 10% within a given week. Keep your diet nutritionally and calorically balanced. If you are unsure if you are taking in enough calories or have irregular periods, we often use our sports nutritionists to help put you back on the right track. and ensure your body has enough energy to maintain proper bone health. Good shoes can help tremendously, and these are not necessarily the most expensive or coolest looking. Knowing how your foot strikes will help you pick out shoes that reduce force throughout your body. An OSU physical therapist or even running shoe stores can help you make this decision and a recommendation for you. In addition, I recommend changing shoes every 350 to 400 miles or so, especially if you have a history of stress fractures. Thanks for taking the time to learn a little bit more about this often frustrating but easily treatable sports injury. Should you or someone you know have concern for stress fracture, seek consultation from a physician with experience treating sports-related injuries. And go Bucks!